In tonight's Health Edge, we're living longer, but we're going broke. For many, health insurance just isn't enough. 500,000 Americans now take $50,000 in prescription drugs a year. And what happens when you need major surgery? Chief Health Editor Dr. Partha Nandi joins us now with an eye-opening report. And Doctor, bidding on our surgery?
It's amazing, isn't it? What's come to it. It's just people are suffering. You know, now some people are turning to price-matching websites for medical procedures. They help patients find doctors that are bidding to do your surgery or procedure, but some are saving thousands. But the concern here is it may not be worth it if quality is being sacrificed. Matt Hutchings had a cough that just wouldn't quit. After going to the doctor, he learned he had a more serious condition than he expected.
They found out I had Barrett's esophagus, and that's where the acids in your stomach come up.
The condition can sometimes lead to cancer of the esophagus, so a specialist recommended surgery to correct this. Now, Matt looked into the cost of the surgery with the doctor who diagnosed him. Even with his insurance, it was going to cost him up to $60,000 out of pocket. So with the help of his insurance company, Matt was able to price match the procedure.
Then we come to find out that there was a lot of other hospitals and doctors that would do it for a much less price.
Matt used a company called MedBid. Now, MedBid is one of a growing number of healthcare bidding websites where doctors can place bids for various procedures.
The goal is to make healthcare more accessible, affordable, allow the employee to really see the quality and make an informed decision.
Ralph Weber started MedBid in 2010 because he felt there was a lack of transparency in healthcare. Now, for a fee, the site lets patients search through prices providers submit for various procedures. Now, Weber says often these prices are lower than out-of-pocket costs from insurance.
We saw a need for having competition so that people can compete based on quality, based on price, and based on location.
Other sites like Clear Health Costs and Pocketdot also helps consumers find prices for medical procedures. But could these types of sites compromise quality of care? Caitlin Donovan of the National Patient Advocate Foundation likes that these websites promote transparency, but she's concerned patients may choose a doctor based solely on cost.
Patients may not do their due diligence. We're also worried that even if they research their doctor, they may still go for the lowest bid. And less expensive is certainly not a guarantee of quality. On the same token, more expensive isn't a guarantee of high quality.
Matt ended up going to a specialist out of state and paid significantly less than the original quote from his local doctor. The surgery was a success, and Matt doesn't suffer from heartburn anymore. It took some extra research and travel, but Matt says he'd do it all over again.
They were excellent, and then I came out 0-0, which was awesome.
So clearly interesting stuff, you know, but so I have to point out, you know, what's going to happen, I'm afraid that quality is going to suffer. People will just look at the prices and go to the lowest, bidding doctor. Now, what about going to your doctor and asking them for some recommendations and then going through with it? Because you have a complication. Somebody has a procedure in California we're talking about and has a complication in Michigan. Who takes care of it? And if you go to the sites, they'll tell you that, you know, guess what? That you will not be able to verify if some of the stuff is real. So you have to go to your own state licensing board. So if I say you don't have the best quality, you as a patient have to figure that out. And there's a lot that needs to be said here. So I think it's innovative because people are suffering from it. If you can't afford it, obviously look into it, but go to your doctor and really look at it and say, listen, is this for me? And look at all the possibilities.
Really do your homework, obviously.
Absolutely. That's exactly it.
Sounds like there's ethics involved in there, too, with doctors.
Absolutely.
We appreciate it, Doc.
Thank you.
And if you have any questions or health concerns for the good doctor, you can email him, Dr. Nandi at WXYZ.com, or send it to us on Facebook or Twitter, and we'll get it to him.